Good news for women with polycystic ovary syndrome. Diet treatment works. A new publication in Frontiers in Endocrinology titled Dietary Modification for Reproductive Health in Women with Polycystic Ovary Syndrome, a systematic review and meta-analysis. This study concludes that the evidence is there that diet treatments work for PCOS. So there is hope. I'm Dr. Brett Scher, the medical director at DietDoctor.com, and I've been critical of studies in the past that talk about a medical problem and talk about its etiology and then say, so now we have to develop more drugs to treat it. Well, this one fits exactly what I like to see in the medical literature, that they talk about the problem and they talk about specific studies that show nutritional interventions work. You don't need drugs, you don't need medications, you don't need surgeries. You need to change the way you're eating, and it has a beneficial effect. And that's what I find so powerful. So let's talk about this study a little bit. It's a meta-analysis. They included 20 randomized controlled trials comparing a dietary intervention versus a control. Now, here's one important point. The study talks about low-carb interventions, talks about Mediterranean interventions, and DASH diet interventions, but they don't compare one to the other. It's comparing a single dietary intervention to a control and saying which of these studies showed the one dietary intervention was more beneficial than the control. And they talk about a number of different outcomes. The ones that I think are most important are clinical pregnancy rate, right? If you're childbearing age and want to get pregnant but suffering from PCOS, infertility is a huge problem with PCOS. And nothing can change your life more than being able to get pregnant. And fertility treatments are expensive and they're hard to go through. It takes a lot of time and effort on your part to go through it. So if you could just change the way you're eating, could that be enough to work? The data says yes. They reported there were 12 trials that reported the effect of diet on clinical pregnancy rate, and the pooled data indicate a higher pregnancy rate in participants with dietary interventions, with a relative risk of 2.87, meaning, we talked about how for observational studies, anything above 2 sort of gets your attention. This isn't quite fixed. It's not an observational study. It's a randomized controlled trial, but it shows you that magnitude is pretty impressive. The 2.87 magnitude is pretty impressive. Doesn't mean 100% of people become pregnant, right? That's not realistic. But increasing your odds, the data says it works. And then subgroup analyses showed that both the Mediterranean diet and low-carb diets were more beneficial to pregnancy. Again, not comparing head-to-head, but comparing those each to control, while the DASH diet had no advantages on the clinical pregnancy rate. So that's interesting. So now we're starting to hash out diet works and which diets work better. What might be the components of those diets that work better? Well, low-carb diets tend to be low-carb. Mediterranean diets can also be low-carb, but do tend to have grains and cereals, but certainly sort of like a more whole foods-based. And then the DASH diet is sort of the typical low-fat, kind of count your calories kind of diet. So maybe that kind of sheds a little bit light, but let's look at some of the other outcomes. Another one was ovulation rate. So that's important because that's sort of related to pregnancy, certainly. Not sort of related, it is obviously related. There are only 4 trials, but here's what I found interesting about these results. The results of the subgroup analysis revealed that improvements in ovulation rate were evident in women diagnosed with the Rotterdam criteria, but they also said, and trials without calorie restriction. Now, I thought this was really interesting because classically, calorie restriction can actually cause amenorrhea and decrease in ovulation. So this kind of, again, sheds maybe a little more light. Maybe it's the dietary interventions that don't purposely restrict calories. Maybe that's why the DASH diet didn't work for pregnancy. Maybe that's why for ovulation rate, only the diets without calorie restriction proved to be effective. And then menstrual function is the next one. There were 7 trials that assessed the menstrual function in both the diet and control groups. And again, the results were in favor of the dietary group. And the subgroup analysis based on diet type, again, it was the low-carb diet and the Mediterranean diet that led to more improvement than the control group. And here's the other part. Women adhering to the dietary interventions for 3 to 6 months did not see the benefit, but more than 6 months and certainly out to 12 months did show the benefit. So now we're starting to hash this out a little bit more. diets that you can stick to for 12 months or longer that don't purposely restrict calories. Those seem to be the more effective diets, at least based on this study. Now, again, doesn't prove that those are the keys, but it certainly suggests it. And look, weight loss helps. We know weight loss helps in PCOS, but does just any weight loss help, or does it need to be sort of a specific type of weight loss? So it certainly makes sense that a healthy weight loss where you're maintaining lean mass and reducing your fat mass, maintaining your resting metabolic rate as best you can, and lowering your insulin levels, which can also lower your androgen hormones. A diet that does that is likely going to be most beneficial. And that's where low-carb diets really do shine for this. Now, does a low-carb diet provide more benefit than just the weight loss? I think the evidence suggests that's the case. We don't have weight loss match controls between a Mediterranean diet or a DASH diet and a low-carb diet. We don't have that data. That's what we would need to say for sure. But, I mean, do we need to wait for that data? Like, why not recommend low-carb diets to women with PCOS wanting to get pregnant? I don't see a reason why not. The concern is always, what about your cholesterol? What about all that fat? But I think we've proven that that's not the case for the vast majority of the people. The vast majority of the people on low-carb diets to treat type 2 diabetes or for weight loss do not see any problems with their LDL cholesterol. In fact, they see benefits with their overall cholesterol profile. It is the uncommon example of the person who's the hyper-responder. And even then, I mean, you could say, look, say your LDL goes up and you're a hyper-responder, but you're doing it for a prescribed period of time to help you get pregnant and have a baby, and then you can go back to a different diet. That seems perfectly reasonable too. So there really, in my mind, there's absolutely no reason why we shouldn't be recommending low-carb diets. Unless, of course, somebody doesn't want it, right? Low-carb diet just doesn't fit with their lifestyle. You can't comply with it. But we have the data to say a low-carb diet can help you with your ovulation, can help you with your menstrual period, and can help you get pregnant. So if that's your goal with PCOS, low-carb diet seems like an obvious solution to me. And possibly a low-carb Mediterranean diet as well could be another option. So I love to see papers like this that really focus on nutrition and trying to hash out different aspects of nutrition. So if you can stick with it for a year, if it's going to lower your insulin levels and it's not going to purposely calorie restrict and it's going to help you lose weight in a healthy way, that's all good. It's all going to benefit you. I think it's going to benefit you whether you have PCOS or not, but this study shows it'll help you with PCOS. Hope that was helpful. If it was, click the thumbs up and subscribe button, and you'll get all our updates here on Diet Doctor News on YouTube. Thanks a lot, everybody. Have a good day.